Good morning, everyone, and welcome to Some Drugs Don't Mix. I'm Sheila Budoff. I'm with Arlington County's 55 Plus program, and I'm delighted that you could join us for today's program. This program is being recorded and will be posted to the Arlington County 55 Plus YouTube channel when time permits. Our presenters are going to be spotlighted so that only they appear in the recording. You're viewing this program through the VCAA Virtual Center for Active Adults platform, which is a platform for Northern Virginia jurisdictions to provide virtual programming for older adults and adults with disabilities. Many thanks to Jennifer Thompson with VCAA for all that she does to provide these virtual programs through the VCAA platform. Also, many thanks to Charlika Ashton, supervisor of Arlington's virtual programming, for her creativity, her vision, and her superb management of Arlington's virtual programming. So many of us don't think twice when we take over-the-counter OTC medicines, pain medicines, antacids, or cold medicines. But if we're taking certain prescription medicines, that could lead to very dangerous results, which is why I thought to have this program. And I have brought in to explain some of these medication interactions and also interactions with foods. I brought in Scott Welch, who is the chief pharmacist at Preston's Pharmacy in Arlington, and Mitchell Monaco, a final year pharmacy student at the University of Montana in Helena, which, here's your weather report, where it is currently 19 degrees. Be grateful, everyone, it's not 19 degrees. So for Scott Welch, as I mentioned, he's the chief pharmacist at Preston's Pharmacy. Before that, he was the pharmacy area manager for Wegmans Food Markets and their divisional pharmacy intern coordinator. I'm guessing he is still a pharmacy intern coordinator of sorts, because that is how we are fortunate enough to have Mitch with us today, because he was a pharmacy intern for Scott at Preston's Pharmacy last summer. But now he is back in beautiful downtown Helena, Montana, finishing up his pharmacy degree and ready to go out in the world as a full-fledged licensed pharmacist. And we're glad that we will have him in that role. Very grateful. Scott Welch holds a Doctor of Pharmacy degree from St. John Fisher University in Rochester, New York, and he holds pharmacy licenses from New York and Virginia. We're going to hold questions to the end, but I'm hoping that you will have questions, because all of us take a lot of medications, or some of us don't, but a lot of us do, and have questions. But I think to keep the flow going, we will hold the questions to the end. You are more than welcome to enter your questions in the chat as we go, but we will address them at the end. Okay, and let me begin. So Scott Welch, our pharmacist in charge for Preston's Pharmacy, is going to lead us off.
Thank you, Sheila. Thanks for the introduction. Happy to be with everyone this afternoon, or this morning still. Like I said, I'm the pharmacist in charge at Preston's Pharmacy. For those of you who are not familiar with Preston's, we're an independent pharmacy that does the typical prescription care of your normal corner drugstore, but we also compound and offer personalized medication. So we go a little deeper in drugs, making customized drugs, spending a little more time with our patients, answering questions. And I think that's why Sheila decided to bring us on, as we're kind of in the community trying to help as many people as possible. Like she said, Mitch is from the University of Montana, and he is going to bring us on a little journey through some drug interactions, some considerations of medications as we age, and what to kind of think about. And this presentation is just to crack the door as you continue to take your medications and think about taking new ones just to get you thinking, is there any type of interaction that could be possible? Should I talk to someone before starting this? And usually the answer is yes, talk to your local pharmacist. So without further ado, I'll hand it over to Mitch, who will start our presentation.
Perfect. And I appreciate both Sheila and Scott. The introduction was great, and I'm super excited to just be able to kind of use my knowledge and what I've been taught in pharmacy school and just kind of share that with anyone. So I'm just going to go ahead and share my screen, and we will kind of just jump right into it here. Perfect. So I also want to just kind of throw a quick shout out to another pharmacy student. Her name was LaDawn. She was also at Preston's with me, and she kind of helped me work on these slides. She was not able to be present today, but I do just want to make sure that she gets credit where credit is due, because she also helped me with these slides. But first off and foremost, we're just going to talk a little bit about aging in pharmacy. I'm going to kind of go over a whole bunch of different topics today, and hopefully at the end we can answer a lot of questions as well. So just a little bit of a guideline of what I'm going to be talking about today. I'm going to talk about Beers List medication, and you might be familiar with that, you might not. I'll go into that and just kind of explain what that means. I'm also going to go into common drug interactions. I'm going to talk about normal drug interactions between prescription and prescription. I'm going to talk about supplements and prescriptions, talk about food. I'm going to go over just a lot of different drug interactions to kind of just be cautious for that you might not be super familiar with. There's a lot of drug interactions that you hear often that you're like, oh yeah, I've heard that before. But there's a lot that you may never have heard of that you're like, oh, interesting, I wasn't aware of that. And then I'm also going to talk about polypharmacy and just explain more about what that is and having different medications that work in the same way. And then also some tips just to help with taking medication, some daily tips that can help you remember to take your medication, how to take them, just along that. And then we're also going to talk about what a comprehensive med review is, and that is a something that is done at Preston's Pharmacy. It is very beneficial to all patients, and I'll kind of just jump more into that as we get there. But first off, I'm just, like I said, I'm going to kind of jump into what the Beers List is, and we'll go from there and just kind of keep working our way down. So what is a Beers List? So it was created in 1991 by a doctor named Mark Beers, and this list was created for adults as they're aging, that which medications might not be appropriate. Because as we age, different risk factors are always coming up. And so not all the medications are appropriate for you as you get older. Whether, as I mentioned on the slides here, they might increase your fall risk. They might cause some delirium. That SIADH is called Syndrome of Inappropriate Antidiuretic Hormone. So that kind of helps control your bladder. And so sometimes as we're getting older, there's struggles with that, and different medications can make that even more difficult. So many medications can do that as well. And other meds can increase your bleed risk. So just like I mentioned, as we're getting older, different medications aren't appropriate for us to take. And so we always have to watch out for them. And a lot of times people and providers and patients and pharmacists can kind of overlook this if you're not aware of it. It's one of those that you always, especially in the pharmacy world, we always know about it, but oftentimes it's not on the back burner, but it's not on the front burner. So having patients that are aware of it really helps not only the pharmacy, but their own self. Being your own advocate is one of the biggest things I can ever say. So just knowing about your medications, knowing what they do, where they come from, why you're taking them, is very important. So some commonly medications that are on that Beers List. Opioids are one of them. You hear about it all the time, but opioids can cause that increased fall and sedation. And oftentimes as we're aging again, we don't want those falls. Falls can be very detrimental and they can cause a lot of damage. And so we want to avoid those. And opioids are a big issue when it comes to that. And same with the increasing sedation. Oftentimes it's in the news constantly about patients and people overdosing on opioids. So trying to be as cautious and as careful as we can with them is very important. And it is on the Beers List because as we're aging, that increased sedation can increase those fall risks. And we just don't want that if we can avoid it. Anti-seizure medications. This is one that's very important medication that if you have a history of seizures, you can't really take it or go without it. So it's important to know what to expect. So it increases central nervous system adverse events. So it might make you more dizzy, it might make you more sedated, it might cause different effects in your central nervous system that aren't wanted. But granted, these are medications that we need to take because we would rather you not have a seizure. So just being aware of what those side effects and what those symptoms are is huge, of just knowing, okay, I'm feeling a little more dizzy than usual. I'm struggling to stand and walk like I usually do. And just knowing whether that's the medication or whether there's a different precipitating factor in that. Gabapentin is another medication with the same increases the CNS adverse effects and increases sedation. And gabapentin is one of those medications that is one of our most common medications that I see in the outpatient setting. I see patients taking very high doses of it, and I see patients taking it all the time. And oftentimes everyone just thinks it's super safe, which it really is a very safe drug. However, there are always those one-off chances where something could happen. And so just being aware of that can go a long ways of knowing, yeah, I'm taking gabapentin and I believe that it's a very safe drug, and it really is, but knowing what the worst case scenario could be as well. Antidepressants, another one that you see all the time. It's a very common medication, and it can increase that syndrome of antidiuretic hormone. So you can kind of lose a lot of control in that bladder, whether it be you're holding urine in too much or you're letting it out. It's just kind of one of those. And again, with fall risk, it has a little bit of a sedating factor. And so just making sure that you aren't at risk for that. Make the extra precautions, whether it be having those guardrails in your house, walking with a walker, using a wheelchair or a cane when you need it. And just knowing that this medication might do that. So I have to take the steps ahead. And same with nausea. No one likes to be sick and be vomiting. And so just, again, I can't express enough just being aware. Benzodiazepines, they're a drug that is really good at what it does, but sometimes it's too good. It can really increase that sedation factor. And you can really, a lot of people do end up taking falls on this medication because it really is like a very mellowing drug that can cause those falls to happen. And so it's one of those that I would say on this list, opioids and benzodiazepines are the two that I'm the most worried about on a regular basis. Patients can have any sort of side effects with them, and so we just don't want them to fall. We don't want to see those major issues. And aspirin's one that you see constantly of people just taking it because they're like, oh, someone told me one time I need to take an aspirin every single day to help my heart. Yes, but no. It's a great medication. It works well, and it's always believed to just be safe because what's the harm in just taking an aspirin? But there really is. If depending on how much you're taking, it can definitely increase your bleed risk. So whether you end up bumping your nose and get a bloody nose that just will not stop, or if you fall and hit your head, well, now we might have a bleed in our brain that we are not aware of. So it really can increase our bleed risk significantly, even though it seems like such a safe and harmless drug. There is a lot to really think about with that medication. It can go a long ways in causing a lot of issues. And so, yes, like I mentioned, it's a great drug. It works amazing. But there's always that caveat of, is it going to increase my bleed risk? What issues may I have if I continue to take this? And some OTC medications that are on that Beers list. Again, it's not just prescription medications to be cautious about. Over-the-counter medications are also on that same list of, as we're aging, we need to be cautious about. And Benadryl is one of those. If you're anything like me, Benadryl just knocks me out. Like I take one, I'm out for a day. I'm super dizzy, super sedated, and I just don't feel great. And that can be very harmful. Again, fall risk is right there. Ibuprofen and naproxen, you might know it as Motrin or Aleve. They may increase the risk of GI bleeds. So oftentimes when you take a lot of these, you can get like a stomach ulcer or something along those lines. If you take too much to where they can cause these GI bleeds that we would believe ibuprofen, Aleve, they're safe. What's the harm in that? But they can have that serious risk as well. Pseudoephedrine, Sudafed, it's your nasal decongestant. It works great. It's awesome. But it can increase your blood pressure. So if you already are having issues with your blood pressure, you're congested, you're like, I just need quick relief, you go get some Sudafed. Well, now we might have a big issue. We might put you in a hypertensive crisis, which means your blood pressure is just way too high. So it's things like that to just be aware of knowing I've got a history of high blood pressure. This is a medication I probably should avoid if I can, just because I don't want to increase my risk for that hypertensive crisis or my high blood pressure just going too high. Prilosec, also known as omeprazole, very common medication over the counter. You see it all the time. Patients with heartburn. It's one of the most common over the counter medications that I think I see. But it can increase your risk for a C. diff infection. So it's just a type of infection in your stomach. And it's not one that 1 or 2 doses is going to do that to you. But if you take it consistently long term and a lot of it, you can get those high risk factors for that C. diff infection. And I promise you, I've seen it in the hospital setting. That's not an infection that you would ever want to have and deal with. So just, again, being aware of knowing how much I'm taking, when I'm taking it, can really go a long ways. So now just kind of jumping in a little bit to some drug interactions. These are the ones on this list are prescription to prescription. I have a couple OTC on this list, but most of these are your prescription to prescription drug interactions. These are all very common medications that I see all the time, every day. And so a lot of people don't know about them though. Like the first one, aspirin, NSAIDs, and warfarin. NSAIDs is your ibuprofen, your naproxen, Aleve, all of those medications. Celebrex, and warfarin, and they can all increase your bleed risk. Warfarin is one of those really finicky medications. I'm probably going to say that drug name at least a handful more times because it's a very important medication, but it interacts with a lot of things. And it's one of those medications as well that as you're taking it, you really have to be aware what you're taking with it. So aspirin, like I said, it can increase that bleed risk. We don't want you to fall and have a major bleed. We don't want you to have a bloody nose that just can't stop. You get a little paper cut that's just gushing blood. We don't want that. And so those are a couple medications to very much be aware of that we shouldn't take together. Benzodiazepines and opioids. It can increase that overdose risk, which is terrifying, but a lot of patients are taking both of these medications concurrently. And so being able to be aware that I'm at a higher risk now to have some sort of overdose event because they work in the same system. And so when you're taking them together, that risk it becomes significantly higher. Gabapentin and opioids. I had mentioned gabapentin can cause sedation, and I also mentioned that opioids can cause sedation. And same with the Benadryl and the opioids on the next line. That sedation can be a very big issue. It might seem great, and you might think, oh, I'm going to get a great night's sleep tonight. It's going to be great. But if you decide to get up in the middle of the night, and what happens if you fall? So it's definitely being just aware of taking those 2 different medications together, and not always do they work the same. They work together. Sometimes they're fighting for that same spot. Oftentimes I explain medication interactions like a busy parking lot and there's only one parking spot left. So you're trying to find that same receptor, and when they're fighting, they just don't work the same. Corticosteroids, so your prednisone, your methylprednisone, and NSAIDs, like I said, the ibuprofen, Aleve, they can increase your risk for GI bleed. Like I mentioned earlier, that ibuprofen has that risk alone, but when you mix it with corticosteroids, your prednisone, your methylprednisone, dexamethasone, anything like that, it can increase that GI bleed risk even more. Lithium and ACE inhibitors. So your ACE inhibitors are your medications that end in PRIL, lisinopril, benzapril, a lot of those medications. And when they're taken together, it can increase the lithium toxicity. So it means you can get too much doses of lithium, which can also cause a whole different gambit of issues. So it's another one that you wouldn't necessarily think of my lithium and, oh, I've just got my blood pressure medication. They'll be fine. Not always. Theophylline and cimetidine. Same as the lithium. When it's taken together, it can make one of the drugs way more effective. And then you have too much in your body. And then you can kind of have those issues of too much medication, which we also don't want. So what about herbal supplements? Are you taking those too? A lot of people are taking those medications, which they think they're safe. And natural does not mean safe. Natural does not always mean safe. And you think that just because it's natural, it came from a plant, it's going to be great, it can do anything, but no. So St. John's wort is one of the worst ones that interacts with a lot of things. As you can see, I just listed a couple medications there that it can reduce the effect of. So if you're taking St. John's wort and your warfarin's not going to work as well. Your INR is going to be all over the place. And we don't want that. We want to make sure that we're consistent. And then same with the tacrolimus and digoxin and venlafaxine. We want to make sure that we're getting the right amount. And when we're taking a medication, like I said, we're in a parking lot, these two medications, warfarin and St. John's wort, they're looking for that same parking spot, but there's only one spot to get it. And usually the St. John's wort can win that, and then your warfarin's not going to work as well. Black cohosh, same thing. Your statins. Everyone seems like these days are taking a statin, atorvastatin, simvastatin, rosuvastatin. But it can reduce the effectiveness. So then if we're taking black cohosh and our statins, our cholesterol is going to be a little high. We want to make sure that we're in that good range of our cholesterols, our LDLs and HDLs. But with the black cohosh, it might not happen. Ginkgo. Ginkgo is another one that can increase that bleed risk while taking warfarin. Just like the NSAIDs or aspirin. Warfarin is one of those medications that the goal is to kind of thin up your blood and make it flow better. But when we're taking ginkgo, it kind of goes too far. And then again, if we bump our head or something, we might have a bleed that we're not aware of. Golden seal is an interesting one. I don't know how many people are familiar with it, but it interacts with more than half of pharmaceutical products. So I would not usually recommend taking golden seal just because it interacts with so much stuff. There's so many medications that can be affected by it that unless you are very aware of what you're taking and whether it interacts or not, it's one that I wouldn't really recommend. Just because you never know with half of pharmaceutical products. I mean, that's thousands and thousands of medications that it interacts with. So just being cautious there. CoQ10, another one that you see all the time that patients are taking over the counter. I sell a lot of it at our pharmacy. People love it, but it can reduce the effect of warfarin. Again, it might not make the warfarin work as well. Yohimbine can increase your blood pressure when you're taking an MAOI. An MAOI is a class of antidepressant medications. So if you're taking yohimbine with it, your blood pressure can start skyrocketing, which again, it's not something that we're really looking for. We don't want that. And so avoiding any type of these can go a long ways. And what about food? Is your food safe? And more often than not, yes, but not always. Even just the food you're eating can interact with the medications that you're taking. So dairy products, a lot of antibiotics you can't take with dairy. Doxy and ciprofloxacin are a couple of those examples to where if you drink milk or have yogurt or anything like that, really dairy products, while you're taking these antibiotics, that infection might not clear up. The antibiotics might not work as well. And so then we've got another issue of it spreading and anything like that. So just being aware what foods you can actually take with your medications as well. And pickled foods, same thing. I'm a big fan of anything pickled, jalapenos, cucumber pickles in general, like love them. But if I'm taking an MAOI, not a great idea because it can increase your blood pressure significantly. And it's very important to just make sure that we're managing that. Big salads, and I put this one on there because it's more of the vitamin K. So if anyone's familiar with taking warfarin, they've definitely heard about vitamin K before, because it's a vitamin that really is the opposite of warfarin, kind of. It's the agonist to antagonist version. So the vitamin K is very essential, and if you're taking too much of it, your warfarin can get all messed up. And it's a lot of making sure you're aware of if your food has vitamin K in it. So spinach, salads, any green leafy vegetable has a lot of vitamin K in it. And so it's not necessarily that you can't take vitamin K. You can't eat those big salads. You can't do that. No, it's you have to be consistent. So if you really like salads, eat salads 5 days a week, great, but you just have to continue eating salads 5 days a week. That's the big thing, is just making sure that you're consistent. And with the vitamin K, the one that I've heard a lot of that people aren't necessarily aware of and is really screwed up with some people is mayonnaise. Mayonnaise actually has a lot of vitamin K in it. And so if you're not aware, if you like a sandwich at lunch every day, and that's what I brought for lunch today, it's got mayonnaise on it. But if you're taking warfarin too and you're eating a lot, it can really mess up your INR, and it can be very kind of tricky to know what's causing that if you're not aware of different foods that have that vitamin K product in it. Grapefruit juice, grapefruit as a fruit itself, it interacts with a lot of medications. It's one of those that I would always, if you really enjoy grapefruit juice, anything like that, I would always talk to your pharmacist first about your medications, because there's so many medications that it interacts with that you have to really be aware of what it is. Like statins, I mentioned statins on there. It can actually increase the efficacy of statins. So then we might get too low of cholesterol, which isn't great. We have to have that kind of Goldilocks window that we're looking for. And grapefruit can kind of make us on the low end of that. And it can also interact with over-the-counter medications as well. Like I mentioned, Allegra, fexofenadine, it's an allergy medication. It can interact with that, so the Allegra doesn't really work as well. So just being aware and having a conversation with your pharmacist about, I really like grapefruit juice. I have a cup every day, whatever. Are there medications that interact with it? And just like I said, every pharmacist you'll ever go to will never be upset or angry or anything about asking a great question like that, because it's awesome. We love when patients take their own healthcare into their own hands and letting them kind of figure it out, and us to be the resource for them to answer those questions. And grapefruit, vitamin K, those are definitely questions that we love to hear, because we know that taking medications can be very challenging. And our role, we're in our own little niche world of drug experts. And so that's what we know about. So we're happy to always answer those questions when you are concerned about, I just started this new food, I started this new medication, can I take them together? Just have the conversation. And so what can you do a little bit? So make sure you fill your medications at one pharmacy. And that way you're not getting confused and having different pharmacists tell you maybe different things, or they're aware of what you're taking. If you're filling 5 medications at one pharmacy, 5 at the other, those 2 pharmacies might not know you're filling the other 5. So just making sure that you're filling at one pharmacy, being consistent, and talking to a pharmacist before starting any new medication. Ask them about those interactions. Ask them, is this going to interact with any food that I like? Is this going to interact with the supplement that I take every morning? Is it going to interact with other medications? Again, make sure you ask your pharmacist about drug interactions. I can't express that enough. And same with the beers list. If you ask your pharmacist, hey, I heard about this beers list and I want to know if this medication is on it, they're going to let you know, and they're going to let you know whether you need to be more cautious or not, if you're going to be fine, or if there's different things that you should look out for. And again, like I mentioned earlier, be your own biggest advocate. Know what you're taking and be active in learning about it and having conversations with your providers, with your pharmacist. The more that the patient knows about their medications, the better the healthcare system can help that patient. Because then we know that you're familiar with it. We know what steps we can take. So I'm going to talk a little bit about polypharmacy. So what is polypharmacy? It's a simultaneous use of drugs to treat a single condition, multiple drugs of a patient for multiple conditions. So if we have a couple different medications that are working in the same way, so a good example is like a blood pressure medication. You could be taking a beta blocker, which is usually used for your heart, and you can also be taking a lisinopril or an ACE inhibitor, which is used for your blood pressure. Well, those beta blockers also kind of work on that blood pressure as well. So if you're taking two medications that kind of work in the same way, they're written for different things, but they kind of work in the same way, it can lower your blood pressure too much. And so then we can have those issues as well. So as it mentions here, it's just the risk for adverse outcomes, medication errors, they increase with the number of medications. So the more that meds you're taking, the higher risk for just some sort of mistake. And it changes in how your body processes those medications. The more you're taking, like I said, there's only so many few parking spots that those medications can fit into. So making sure that they're not fighting each other and working in the same way. And so, again, some of these medications can cause side effects that you're not aware of. Is it the disease or is it the drug that's causing a side effect? And Parkinson-like movements is a great one because a lot of times you can get those tremors and you're worried about whether it's you have Parkinson's or is it this new medication that I just started that's doing that. And I list a whole bunch of medications on there. Antipsychotics are one of them, antiemetics, different mood stabilizers and antidepressants. They can really cause a lot of those Parkinson-like movements. And so just knowing and having conversations with your provider about, I've got these new symptoms, my hands are starting to shake, I'm starting to have trouble with my words. Okay, well, let's talk about when did it happen? Was it right as we started a new medication, or was this something that was already kind of ongoing? And we just need to kind of figure out, is it the drug causing your issues or is it the disease? And same with edema. If you're holding on to too much fluid, you get those swelling in your legs. Amlodipine is very notorious for one of those for doing that. And so is it some sort of other issue that you have a clot that's causing the edema, or is it just the amlodipine that's making you hold on to too much fluid? And same with the dry cough with the ACE inhibitors, lisinopril, ramipril, fosinipril. They can very notoriously, you talk to patients all the time, you hear it, that they get this really dry, nasty cough that they can't get rid of. And it's not necessarily that they've got a cold or anything like that. It's the medication causing it. And so again, just having the conversation about, yeah, I just started this cough. It happened just a couple days, couple weeks right after I started this new medication, like, and it just hasn't gone away. Like, what do you think? Like, and then that's when the conversation happens about like, okay, maybe we need to switch you to a different medication, different blood pressure medication. And then that way the cough will go away and it's not actually the cough itself. It's just the medication causing that. So how to manage polypharmacy? Pay attention to the onset of those symptoms. Like I said, know when you started that medication, know when your side effects, your symptoms kind of came up. And then talking about what side effects are possible. If you ask any pharmacist when you're taking an ACE inhibitor about lisinopril, what are some side effects? First thing that they're going to tell you is that there's a chance for a dry cough. It's very common. And so just being aware and being willing to ask the pharmacist. If I can say anything, it's never be afraid to ask the pharmacist. There's never a stupid question. That's what we're there for. We're happy to answer those questions always. And take advantage of medication services. Comprehensive med reviews are great. I'll go into those a little bit more here in a little bit, but just being able to do a full workup of your med list and just talking about this is what I'm taking, this is what it does, these are some side effects. And deprescribing, I'm going to jump into that a little bit here, but deprescribing is huge. So it's the planned and supervised process of reducing the dose or stopping it. So it's not necessarily saying that we just want to cut you cold turkey. Some medications you can, but some medications you can't stop right away. And so we call it usually a titration. We're titrating down, we're slowly reducing your dose, just so you don't have any of those side effects if you suddenly stop. And deprescribing, again, is not, as it says on the slide, it's not a discontinuation of care. It's a joint effort to reduce the medications that you're taking if you don't need them. With that polypharmacy, a lot of times those medications, like I said, they're kind of working in the same way, doing the same thing. So not always do we need everything that we're taking. And so having to be able to deprescribe and work down what is important and what isn't important, and how can we slowly get it to the best regimen possible with the least amount of side effects possible. And so it's a joint effort. It's talking with patients, prescribers, pharmacists, getting those schedules to figure out when we want to titrate, when we want to lower stuff, really does help. And again, there's evidence-based algorithms that deprescribing is huge. So PPIs are a big one. A lot of times it's omeprazole, lansoprazole, those medications, Prilosec. They're medications that you're used for heartburn. And a lot of people I see that get started on it, once they're on it, and they stay on it. And so it's one of those medications that you don't really want to stay on always. And so just being aware of like how I should be taking this. And as it says here, there's different programs and different exact literature guidelines that teach us how to kind of lower those doses. And just knowing lifestyle changes are huge with different medications, and how to manage it with, if you've got an onset, take it always, but now I've got a little more heartburn. What can I take? I don't want to take the omeprazole again. Well, just take a Tums, take a Zantac, something along those lines. Or then also going from twice daily to once daily to every other day to just when I need it, is really helpful, so you don't have any of those issues. Like I mentioned, these PPIs, omeprazole, they have that risk for that C. diff infection if you take them too often. So trying to make sure that if we don't need to take them, let's not. Antipsychotics, same thing. We want to make sure that that's not a medication that we're really going to want to just stop cold turkey. We want a very systematic plan on how to decrease that dose appropriately. And benzodiazepines, they're one of the biggest ones. Once patients are on them, it's very difficult to get off of them. And so you really have to have a good, strong plan on how to slowly decrease your dose to be able to not have any withdrawal symptoms or anything like that. And making sure that you're really taken care of and not taking a medication that's on the VAERS list that if you don't need it. Oftentimes, a lot of patients do need it, which is great. Let's figure out the lowest dose effective so we're not having any side effects like that. Let's work our way back down. We'll find where we're effective at, and then we'll kind of stick there. And it's a lot of those conversations that us as pharmacists, we're happy to have. We want to have those conversations. That's what they teach us in school. We love figuring this stuff out. So a couple tips to keep track of your medication. I know it can be very difficult, especially when you're taking an awful lot of medications. If you're taking 5 or 6 meds in the morning, 5 or 6 meds in the evening, and then 1 or 2 throughout the day, it can be very difficult. I'm probably one of the worst patients there is when it comes to taking medications. I always have a hard time taking that medication. So I know if I'm taking a whole bunch of them, I could imagine how difficult it would be. So one thing that a lot of pharmacies do, it's called bubble packing. And so that's when the pharmacy will actually basically set up your meds for you. You'll get a little package and it'll tell you Monday at 8 a.m. you take these meds, and they're already all set there. All you have to do is open it up and take it. And it's great, and it can be broken down throughout the day, whether it's morning, noon, evening, night, and it's all kind of set up for you. So bubble packing is a great opportunity for patients who really struggle with taking a lot of meds. And you're just basically giving the pharmacy the power to do it for you. Let them worry about the hassle. You don't have to worry about anything except for opening a container and taking the pills when you need to, which is awesome. A lot of patients really like that, and it's a very beneficial thing. And also using a daily pill box. I kind of just threw a little picture of one on there. I know patients who just use their normal pill bottle and they can get away with it great, which is awesome. But not everyone can do that. So really just setting out and putting your pills in a little box so you're aware and you know exactly which ones to take, when to take them, is huge. Set alarms, especially if you're taking medications a couple times a day. Set alarm on your phone, or if you've got an Alexa in your house or an iPad or your computer or anything like that. Just setting alarms to remember. It's not that difficult to just have a little beeper come off and be like, oh, it's noon, I need to take this medication, and then it's there. And that really goes a long way of just having some sort of reminder. And then flipping the bottle upside down. This is actually a really good one for people who take a med twice a day. So you have the bottle right side up in the morning, you take it, and then you put it on its cap, and then in the evening you take it and you flip it back over. So then you know if you took it in the morning or the evening based on which direction the bottle is facing. It's just such a little simple thing to do, but if you get in a good habit of it, it's going to be really beneficial of knowing, oh, my bottle's upside down. I didn't take last night's medication. I need to take that. And just kind of knowing where you're at, and then double check. I can't express that enough. Mistakes can be made. We're all human. It happens all the time. So just making sure you're double checking. Having someone else, a spouse, a relative, a family member, anyone who's around to just, maybe if they're aware of your meds, have them take a look too. It's never going to hurt to have an extra set of eyes on something, because especially when you're taking a whole bunch of medications, one pill can get put in the wrong pill box the wrong day. A Wednesday can get thrown into Tuesday by accident or something like that. So just making sure that you get some sort of double check, and just knowing that, yes, okay, I've got all my meds lined out for this week. It's great. And then you won't have those issues that we're talking about of different, taking too much or taking too little or anything like that. So a little bit about a comprehensive med review. So what it is, Preston's does this. It's a great opportunity. So they'll go over all of your prescription and non-prescription drugs with you. You just kind of let them know the name, strength, how it's taken, when to take it, what are the side effects, what are we looking for, what are our goals, how long is it supposed to take to work. And this is something that can go a long ways. You actually can sit down with a pharmacist or pharmacy student, and just have a conversation about your medication, because a lot of times those conversations don't happen. You go to the clinic, you do your yearly checkup, they say, what meds are you taking? I'm taking A, B, C, and D. And like, okay, great. And then that's it. But it's not the conversation of, okay, you've been taking medication C for over a year now, and you're not having any issues with why we were taking it anymore. Do we really still need to be taking it? And not always. And so just knowing what it is. And then again, the big thing here, about this whole presentation is drug interactions. Pharmacists have those resources to be able to check all of your drug interactions, whether it be your prescription to prescription, or your OTC to prescription, or supplements and prescription, or OTC and supplements, anything like that. The pharmacists have the ability to be able to check those. And so knowing whether or not I've been taking all these medications, I've just got a couple new prescribed, I had a new doctor, I'm taking all these new medications, are they safe together? Talk to the pharmacist. We love to go through these, have full conversations, just completely understand your medication profile. For a lot of people, it can be very confusing, especially when they're taking a lot of medications. So just kind of making sure that you are fully aware of your healthcare. Like I said, being your own biggest advocate and doing your own is the best thing that you can do. And pharmacists, our role is to be there and help and assist with that. And at Preston's, they do this over the phone, in person, at any time. You can go give them a call, go in, and someone's going to be happy to talk to you about it. They're going to be willing to just kind of help out and make sure that you're all taken care of, and just know your whole med profile. I'll kind of just pitch in. Scott, did you want to throw anything here on this slide about what Preston's offers a little bit?
Yeah, no, that's great. And kind of what I mentioned at the beginning, we're all about the personalized medication. So having a CMR review is great. A lot of questions that I'll get to is someone will come in and they've tried XYZ medication for a certain disease state or indication. It's not working. The doctor's out of ideas. Come talk to a compounding pharmacist. There's stuff that we make in our lab that's not commercially available, that isn't always thought of, because compounding is not mainstream medicine, but it works great. So I've made several medication recommendations of a compounded medication that works better than commercial, that's very affordable, and it actually solves the patient issue. So that's just another benefit of doing this and having more healthcare providers as a team looking at your medications and your conditions, is to kind of putting more than one head together to figure out how's the best way to treat your current condition.
Yeah, and so like Scott had kind of mentioned, it's just one of those great things where you can kind of come in full circle, get the patient, the provider, the pharmacist all in on your medications, to understand them, and just be willing to be open and understand that medications are confusing. I mean, I'm going through school right now. I'm just finishing up, and I still don't know hardly anything, it seems like. It seems like every day that there's a new med coming out, we're learning all about it and stuff. So it can be very confusing, even for me as someone who deals with it basically 24/7, 7 days a week. And so with people who aren't super familiar with it, those struggles can just be elevated even more. And so just taking the time, and pharmacists, we love to do this. So talk to your pharmacist, let them know, hey, I want to do a quick little CMR, and we can just kind of be willing to answer all of those questions for you. And then I threw a couple little resources on here. One thing that I would recommend is going to PrestonsPharmacy.com. They are happy to, they've got a good website. They kind of show everything out. The Canadian Prescribing Network, and these are all things that you can just Google. There's links here. I don't know if this PowerPoint is going to be shared with you guys, but Google, you can just Google these, the Canadian Prescribing Network. And so that's a system that kind of helps you learn and understand about how to lower those doses and deprescribe. And then the Beers List, 2019 Beers List is the most up-to-date one as of right now. And I would highly, highly recommend anyone to just Google it, take a quick glance at it, and see if there's a medication that you're taking that's on there. There's an awful lot of medications that are on that Beers List. I only listed a handful today, but there's a whole lot more that are on that list. So it's definitely something that I would recommend everyone kind of just go take a quick Google at. Just look and see, am I taking a medication that's on here? What can I do about it? And on there, there's always good resources and everything like that. And then also drug disposal. That's another one that's very important that a lot of people don't know about. You can kind of just Google drug disposal place near me. If we're deprescribing, we're not taking a medication anymore, what do I do with it? I can't throw it down the sink. I don't want to throw it in the garbage. Like, what do we do about it? And so again, just a quick little Google can kind of take you to some good resources where you can learn even more. And like I said, I can't express enough. If there's anything that I can express to you guys and get away from this little thing, is be your own biggest advocate. Just be willing to go out and take care of your own, and learn and be educated. And we are always that resource that can answer the questions for you. So I think that's kind of really all I've got right now. I kind of just want to open it up and answer a lot of questions. Whatever you've got for me or Scott, we're happy to answer whatever questions you've got.
You've got a bunch of questions. You have a very active audience here who have put some questions in the chat. I don't know if you want me to read them.
I did get one question direct to me that I can answer first.
Okay.
From Tammy, and she asked, what is warfarin for? And that is a medication that people use as like it's not necessarily a blood thinner, but that's the simplest way to put it. So it kind of helps reduce your risk for clots. So you don't have to worry about getting a stroke or having some sort of pulmonary embolism where a clot can kind of go into your lungs. And so that's kind of what that medication is for, is basically to avoid clotting.
Okay, we have another question. Would it be useful to get information on interactions with DOACs like Eliquis and Xarelto, as well as warfarin? And do all the interactions with warfarin apply to DOACs too?
So no, it is good. I'll start with, it is good to definitely check and worry about those interactions with Xarelto and Eliquis. All the medications that interact with warfarin don't necessarily interact with DOACs. The DOACs are kind of in their own brand new class, and that's kind of why people are a lot moving to them, is because the safety of it. They don't interact with nearly as much stuff as warfarin does. And so it is definitely something to look and talk to your provider about. I'm taking these medications, I'm taking a DOAC. What are some of the common drug interactions? But it is not the same interactions between DOACs and warfarin. If that answered the question, I hope. Good.
And you can unmute yourself if you would like to answer. As a follow-up, I guess, to that, assuming a patient tells their various doctors all the prescription meds and OTC meds that they're taking, who's responsible for checking for the interactions? The doctors, the pharmacist, the patient? And do you recommend any website where people can double check the interactions for themselves?
Yeah, so usually it is between the pharmacist. We've got all our software. So oftentimes when you talk to your doctor, either they'll do it, or if you're doing like some sort of med review at a hospital, a farm tech usually does that, and they bring it to the pharmacist and they kind of look at that. And then all our computer software is like we're filling and stuff. It's super smart these days, so they kind of help us out. But there's one website that I usually can kind of go to. It's not 100 proof. Usually, as Scott mentioned earlier, the really good ones are all subscription based. So the pharmacists all have access to that. But one that I very occasionally use is just like kind of a quick, I want to check, it's called drugs.com. It's not a horrible website. It actually has pretty good information. It's not all there, but for a quick check on your own, you just started a new med, you want to get a quick little check. Drugs.com, it's got an interaction checker. It's not bad. But usually if you can Google just interaction drug checker and something will pop up. But again, I would take all of those with a grain of salt. You can get a quick little idea, but I think it'd be more beneficial to talk to pharmacists or doctors. Doctors and pharmacists have the same resources that are a little more advanced, and it can kind of give us an even better idea.
And I'm gonna piggyback on that question too. Everything Mitch said was right, but as far as interactions, my answer is everyone should be responsible: the prescriber, the pharmacist, and the patient. Especially in today's world, post-COVID, where everyone's busier and running around, and maybe they don't have the employees that they used to. Getting in touch with healthcare providers to communicate is challenge for everybody in every sector. So there are several times where maybe a doctor makes a recommendation to a pharmacist or vice versa, and the communication hasn't been completed. You should advocate, again, the main message: advocate for yourself, ask the questions. What do you think of this new medication at this dose to your pharmacist or provider? Because there's times where we try to make drug regimens more effective, but the doctor never gets back to us, or just decides to keep it the same, just maybe because they're busy and they don't have time to review it, or they don't understand it. So if everyone's working together, it makes it easier. One person on their own can't do everything. So that's why you becoming an advocate and playing an essential role in your healthcare is very important.
Okay, this is kind of switching gears. Thank you for that. This is switching gears. We've had a lot of talk about Advil, but in its generic form. But what about acetaminophen, Tylenol? Does that interact with other things?
It does. There's not a medication out there that doesn't interact with something else. Tylenol is definitely top tier, one of the safest ones. There's very few medications that it does interact with. The question you would be looking at and trying to figure out at that point is, does this other medication I have some sort of liver toxicity? Ibuprofen, or not ibuprofen, excuse me, Tylenol, acetaminophen, is one that's kind of the big thing, is acetaminophen or liver toxicity. So not necessarily a lot of drugs that it interacts with, because like I said, it's one of the safer ones, but there is food like alcohol. Taking Tylenol with alcohol can be very detrimental. It can really do a lot of damage to your liver. And so they even say, like, if you're hungover in the morning, you don't want Tylenol, because it can kind of do damage to your liver. So again, it is one of the safer ones, but there isn't a medication out there that doesn't interact with another one.
Relatively speaking, is Advil safer or Tylenol safer, or
I
just
wouldn't
different?
necessarily say one is safer than the other. They kind of do different things. Ibuprofen kind of works as an anti-inflammatory, and Tylenol is more of an analgesic. It's kind of there to help reduce pains and fevers, while the ibuprofen is more of like the anti-inflammatory, reduce swelling. So they kind of work differently. They're both very safe, but they've got different mechanisms, I guess. So I wouldn't necessarily say one is better than the other. For a different disease state or different issue, one is better than the other, but overall, I wouldn't say one is better.
Mm-hmm. Okay, thank you. You've gotten some great questions here in audience participation. We have another great question, which is, for the comprehensive med review, One of my prescriptions comes from an online pharmacy because it is too expensive at a retail pharmacy. Other meds come from a retail pharmacy. How do you do a CMR in that case, with some coming from a retail and some from an online pharmacy?
Yeah, and in that situation, when you're involving multiple pharmacies or maybe a really complex medication list, what we would do is really want to set like an appointment, schedule an appointment, and try to gather all that information a minimum of 25 or 24 hours ahead of time. So for this particular patient, I would, we could via email is usually the easiest. I have a template. I would send that. I would say, please fill this out as completely as you can with your medication list. That would give our pharmacist or myself time to then review it, look at it, match it up to any drugs that we fill or the entire med list, and then we can still have a conversation about dosing, efficacy, timing, interactions, and so on.
The big thing there is just making sure that the pharmacist who is doing it is aware of all of them. That whether it's just their whole list at the pharmacy, just letting them know, hey, we're doing this. I also take this one medication that I get from out here. So just letting them be aware of what that med is.
Fabulous. Okay, do we have any other questions? I think we've gone through all the ones on the chat. Here we have someone is mentioning the National Library of Medicine has an online guide for medicines. Let's see what it's called. Medlineplus.gov. Just another resource. If you have a question and haven't put it in the chat yet, but you'd like to ask, please feel free to unmute yourselves and ask away. We'd love to hear from you. You have two experts here who can answer your questions. Don't be shy. Going once, twice. I think that's final question then. So I would like to then just sum up by saying many, many thanks to Mitch and Scott. This has been superb, truly superb, very informative, helpful. It's and you presented everything in such an understandable way. Really, really appreciate it. You've done a real community service here today, and we appreciate it. And a community service from here locally and also from Helena, Montana. So thank you, and try to stay warm there. Yeah. An extra coat. Don't forget your gloves and your hat. Yeah. And Scott, thank you for all that you do at Preston's. We really appreciate it. It's wonderful to have such a reliable, dependable pharmacy in our area. And thank you all for joining us. We hope you enjoyed it. I know I've learned a tremendous amount from this, and I appreciate it. Thank you both, Scott and Mitch. We look forward to seeing everybody at another virtual program at 55 Plus. Take care, everybody. Be well.
Bye. Thank you, everybody. I appreciate it.